The Court for Improving Healthcare is now in session. The Honorable Judge Reason and Logic presiding over the trial of the Medicare rules requiring physician supervision of certified registered nurse anesthetists. Dr. Does no work for the anesthesiologists and Nurse Alice Maga for the nurse anesthetists.
Dr. Does no work. What is the anesthesiologist's first argument in support of maintaining the Medicare rules requiring physician supervision of certified registered nurse anesthetists?
Your Honor, the American Society of Anesthesiologists believes that anesthesia is the practice of medicine, so nurse anesthetists must be supervised by a physician.
Nurse Maga, what is your rebuttal to Dr. Does no work's argument that anesthesia is the practice of medicine?
Your Honor, in the mid-1800s, when anesthesia was in its infancy in this country, it was originally the task of nurses and junior interns. Nurses provided anesthesia care during our Civil War, and still to this day are the primary providers of anesthesia in support of our military. In fact, nurse anesthetists trained physicians in the practice of anesthesia at one time. During this long history of nurses providing anesthesia care, multiple courts have found that anesthesia is the practice of nursing when performed by a nurse and the practice of medicine when performed by a doctor.
That is interesting, Nurse Maga. Nurse anesthetists have been performing anesthesia for over 150 years, and multiple courts have found anesthesia to be both the practice of nursing and of medicine. Doctor, do you have another argument in support of maintaining the Medicare rules?
It is the opinion of the American Society of Anesthesiologists that anesthesiologists are capable of providing additional medical services for the patient, eliminating the need for an intraoperative specialty consultation with another physician, which makes the anesthesiologist a more cost-effective choice for the patient.
Nurse Maga, do you have a reply to the doctor's argument regarding the efficiency of anesthesia services?
Nurse anesthetists are also capable of providing the complete spectrum of anesthesia services when allowed to practice at the full scope of their education and training. Additionally, a study published by Hogan and colleagues showed that a solo nurse anesthetist providing anesthesia services is the most cost-effective anesthesia delivery model. In fact, the solo nurse anesthetist model is the only model that does not usually result in a net loss for a healthcare organization for the delivery of anesthesia services. Because anesthesia providers are unaware of each patient's insurance information, a significant percentage of anesthetics are performed in accordance with the Medicare physician supervision rules regardless of the reimbursement method. Therefore, the restrictions of the Medicare reimbursement rules have resulted in the adoption of inefficient anesthesia service delivery models for an even broader range of patients in the United States.
The difference in efficiency that was demonstrated in Nurse Maga's study sounds very compelling, Doctor. Why should these inefficient practice models be continued?
Again, according to the American Society of Anesthesiologists, anesthesia outcome studies have suggested that physician involvement improves patient outcomes. The most comprehensive of these studies was published in the July 2000 issue of Anesthesiology. The University of Pennsylvania study compared cases in which an anesthesiologist directed the care to cases in which he or she did not. Many of the non-directed cases involved supervision of a nurse anesthetist by the surgeon or some other physician. The study reflects 25 excess deaths per 10,000 Medicare surgical cases when a physician anesthesiologist is not directly involved in the case.
Nurse Maga, that is very incriminating testimony by the doctor. What is your rebuttal to this evidence?
In 1980, the first published study on the subject found no difference in outcomes between nurse anesthetists and anesthesiologists. During the next 32 years, no scientifically sound study has ever shown a difference in anesthesia outcomes due to the type of anesthesia provider. The Center for Medicare and Medicaid Services reviewed the study referenced by Dr. Does no work. The CMS found that study is not relevant to the policy determination at hand because that study did not evaluate nurse anesthetist practice with and without physician supervision. The study did not present evidence of any inadequacy of state oversight of health professional practice laws. After the Pennsylvania study was published, 2 other large studies have looked for differences in outcomes, specifically for Medicare beneficiaries. The first study looked at over 400,000 anesthetics for Medicare beneficiaries from 22 different states and found no differences in outcomes between nurse anesthetists or anesthesiologists working alone, or nurse anesthetists and anesthesiologists working as a team. The second study reviewed over 480,000 hospitalizations, looking for differences in anesthesia outcomes between states that have and haven't opted out of the Medicare supervision rules. Again, no differences in anesthesia outcomes could be identified. Finally, Your Honor, malpractice rates for nurse anesthetists have decreased by 40% since 1988, indicating the outstanding safety of nurse anesthetists. Obviously, if nurse anesthetists were unsafe anesthesia providers, then the insurance industry would instead raise their malpractice insurance premiums.
After listening to both sides, I'm now ready to make my ruling. Nurse anesthetists are safe and efficient anesthesia providers, and they're capable of providing the full spectrum of anesthesia services for Medicare beneficiaries. The elimination of Medicare's rules requiring physician supervision of nurse anesthetists will increase access to anesthesia services. It will do this by increasing the availability of anesthesia providers by eliminating unnecessary duplication of care. Federal rule changes are clearly needed to allow states the ability to regulate their healthcare workforce, especially in preparation for 32 million previously uninsured Americans entering the healthcare system in 2014 due to the Patient Protection and Affordable Care Act. I therefore find that the Medicare rules requiring physician supervision of certified registered nurse anesthetists unneeded for patient safety and overly burdensome for the states.